Our video is about to promote and protect the health and the well-being of the community. We will help to prevent diseases and will keep people from getting injured. A natural disaster happened in the city, and the accumulation of trash has caused multiple diseases.
Our hypothesis is if we as public health and welfare provide help and prevention measures to the people in the city, diseases can be stopped and prevented. Our prediction is that if we provide people with clean water for drinking and for sanitation, medicines, and safety measures in order to not get sick, then diseases will be stopped from spreading. One of our superstitions is that if we implement our solution correctly, we suppose that we could help at least 10,000 people and they can get healed. Also, we think that the city will be in shape faster because the citizens will be provided with aid, therefore most of them will be able to volunteer to help reconstructing the city. Our design is composed by the study level being correlational, our purpose observational, our focus qualitative and quantitative, and the duration is of 1 or 2 months. Methods. Tools to get the data are observation. Our organization method are tables, and our statistical tool is dispersion.
We work with the Red Cross, which has experience in this kind of situations. We, as a Department of Public Health and Welfare, will use food, water, clothing and shelter that the Red Cross provides to increment the chances of the people to not get sick. And this will allow us to spend more time with the people that has already been sick, by the accumulation of trash caused by the flood. During the flood, education on hygiene, hand washing, safe water, sanitation facilities, and appropriate shelter are very important to prevent diseases. Therefore, we'll set up a rapid disease risk assessment as soon as possible, preferably during the first week of the disaster so we can identify the impacts and their health needs within the population. The prevention and control measures will be established quickly and adequately. As well, there will be a case management and surveillance system to decrease infectious disease burdens. All of this will be properly coordinated by our sector in order to get a positive response and assessment.
When investigating the Mexican Social Security Institute, we found the actions to be taken by the operational level in the case of floods. Develop a plan to protect medical equipment, healing material, supplies, or important documentations at risk. Identify and dispose of safe places as well as evacuation routes. Provide safety kits that contain important inputs to keep better response in case of emergency. Ensure good condition of vital lines, storage, and distribution of drinking water. Check levels of gasoline, diesel, and the energy for ambulances and engine room. Verify and maintain optimal levels of stock and supply necessary for continuity of operations in case of impact and mass balance of victims. We focus on 3 main case studies in order to improve that our methods would tackle the problematic. The first one is West Timor, in which dilute bleach and water treatment instructions were provided to flood victims in West Timor in April of 2014, and after 2 weeks a survey suggested that diarrhea rates decreased by 56%. A case study in Guatemala, in rural households, chlorination and safe storage of drinking water decreased diarrhea incidents. And finally, in India, during the Chennai flood report, by implementing a 24x7 surveillance programs to identify the symptoms, large-scale medical camps, and medicine distribution, India managed to reduce the number of cases of leptospirosis from a flood in 2011 to the 2015 Chennai flood. Awareness campaigns and bleaching powder packets were also distributed across the city households.
Since there has been this natural disaster in the city, and after having investigated, we conclude that our role is essential to help improve the situation of the city, and our hypothesis has been proved through case studies and research. A huge number of people has been injured because of accidents, and others have been affected by the diseases that had spread during the flood. The city needs to evacuate people, transport them to a hospital or at least a shelter if the situation is severe, and provide them medical treatment. With this,
the citizens would improve their health. Additionally, we analyzed and had reflected that to also help avoid the situation to get worse, we could make preventions and trainings to personnel so they know what to do in case another hurricane happens.